Hello all and welcome to HIPAA compliance training for 2023. CMS requires that all healthcare professionals receive HIPAA training annually. I thought that this would be the easiest way to satisfy that obligation. So I hope that you enjoy the presentation and that you are able to remind yourself of information that you may already be familiar with. Hopefully this is a refresher to you, but there may be some new nuggets of information that you haven't heard before. If you have any questions at all about the presentation at any time, feel free to send me a message. I'm happy to respond to those and answer your questions at a later time. Course description and objectives. This presentation is meant to provide you with an overview of HIPAA with an emphasis on HIPAA privacy and data security rules. The objectives are to define HIPAA and describe its purpose, describe the key features of HIPAA, identify the entities affected by HIPAA, describe the components of HIPAA privacy and security rules, understand how HIPAA will impact you and the organization, explain the general rules around complying with HIPAA, identify potential HIPAA breaches, and understand the importance of reporting and investigating possible HIPAA violations. So what is HIPAA? A lot of times we talk about HIPAA like I can't tell you something because of HIPAA, I'm not allowed to do that because of HIPAA, but we may not understand exactly what that is implying. So let's go into detail about what HIPAA actually stands for. HIPAA is the Health Insurance Portability and Accountability Act of 1996. It's a federal law that required the creation of national standards to protect sensitive patient health information from being disclosed without the patient's consent or knowledge. Who has to comply with HIPAA? There are two categories of organizations that have to comply with HIPAA rules. First of all would be covered entities. This includes healthcare providers, health plans, and healthcare clearinghouses. As the Family Care Center and the urgent care, we fall under healthcare providers. So we are a covered entity that has to comply with HIPAA. The other category would be business associates. These are organizations that do not provide direct patient care, but are still involved with the care of the patient. And so this is organizations like Aledade, Frisia, our accountants, JP Long, they're covered, a business associate, and our IT person, Derek Earls. These are just examples of business associates. HIPAA rules. So there was the law that's created. How will we satisfy the law? There's these more specific rules that give us guidelines to follow. The rules fall into two categories, the privacy rule and the security rule. I like to think of it as the privacy rule is about the exchange of information. There are appropriate ways that you have to communicate with other healthcare professionals about a patient's care. And so the privacy rule is about transmitting that data. The security rule is about the data that we have or that we create or that we received and how we're going to keep that safe and protected. So let's dig into those rules. The purpose of the HIPAA rules is to protect the privacy of health information. It protects patients' rights, provides the appropriate level of technical protection for the security of electronic patient health information, improve the quality of patient care via improved clinical data access, and reduce the vulnerability of internet-based technology to security breaches. So the privacy rule. The privacy rule protects our patient's PHI while letting us securely exchange information to coordinate the patient's care. During this presentation, we'll talk a lot about PHI. What does that stand for? It stands for Protected Health Information. PHI is considered such when the health information is combined with at least one patient identifier. Health information is any information that relates to a patient's past, present, or future physical or mental health condition. This includes healthcare services and payment provided for those services regardless of whether the patient is living or deceased, and regardless of the form in which the health information is maintained. So just because a patient passes away does not mean that their HIPAA rights expire. We have to maintain those rights for that patient, and whether we receive that information as paper or as a ePHI, we have to maintain the privacy of that information. What are the 18 common HIPAA identifiers? This list includes names, dates except for the year, telephone numbers, geographic data, so that would be like an address, fax numbers, social security numbers, email addresses, medical record numbers, account numbers, health plan beneficiary numbers, certificate and license numbers, vehicle identifiers including license plate numbers, web URLs, device identifiers and serial numbers, internet protocol addresses, full face photos and comparable images, biometric identifiers that include a retinal scan and fingerprints, and any unique identifying number or code. So this would be like if a private investigator was hired to try to get information about a patient, what could they figure out about them? So any unique identifying information to that patient must be scrubbed from the data, or we must keep private according to the guidelines set in the privacy rule. So requirements of the privacy rule. Notify patients about their privacy rights and how to use their information. Adopt privacy procedures and train employees to follow them. Assign an individual to make sure you're adopting and following privacy procedures. So that's my role in this company. And secure patient records containing PHI so they aren't readily available to those who don't need to see them. So the security rule, secondly, includes security requirements to protect patients' electronic PHI or ePHI confidentiality, integrity, and availability. The security rule requires you to develop reasonable and appropriate security policies, ensure confidentiality, integrity, and availability of all ePHI you create, get, maintain, or transmit. Identify and protect against threats to ePHI security or integrity. Protect against impermissible uses or disclosures. Analyze security risks in your environment and create appropriate solutions. Review and modify security measures to continue protecting ePHI in a changing environment and ensure employee compliance. The next section, we're going to talk about access and disposal of PHI. I want you to think of some ways that you access PHI and ePHI in our office. Those would include eClinicalWorks, paper charts or mailed medical records, Phreesia, the Alidate app, UpDocs faxes, even speaking with third parties, other clinicians, pharmacies, and insurances. In the live presentation, a couple more that we considered would be KHIN, WebIZ, any Availity, any online source that you're accessing medical records. Those are all secure ways to access that information. Some things that you'll notice are not on this list would include texting, email. Those are not automatically secure ways to contact a patient or to exchange that information. If you are texting or emailing about a patient, that is not HIPAA compliant, and so I would warn you to take precautions to not exchange information that way. If you have questions about how we can exchange information HIPAA compliantly, let me know and we can talk through different scenarios. Rules for accessing PHI. Be sure you only access the minimum information necessary to do your work. If you are seeing a patient for an acute care visit, it is not appropriate to review their hospital records from 10 years ago. It's not relevant to the visit today, and so you do not need to scrub the chart for every single visit from now to 10 years ago. If it is necessary, of course, you should look at that information, but you should only access the minimum information necessary to do your work. Also know that access to an information system does not mean that you are authorized to view or use all the data in that system. Just because you have access to eClinicalWorks and because you can click into patients' charts doesn't mean that you should, especially not out of just curiosity's sake. Dr. Davis's staff shouldn't be checking on Dr. Dennett's patients. Dr. Dennett's staff shouldn't be checking on all the urgent care patients. There's no reason to be clicking in charts for patients that you are not actively have a role in their health care. Rules for disposal of PHI. Proper disposal of PHI is required when no longer in use or needed. Paper documents containing PHI must be shredded immediately. It's best practice to empty your shred box immediately and not to have a shred box at all. However, I understand that that may not always be possible. Please get into the practice of emptying your shred box at the end of the day and not leaving those shred boxes full overnight. It's best practice to not have any paper records sitting out on your desk that could be available to someone that's in the building. Media containing PHI, including CDs, discs, thumb drives, must be cleaned or sanitized before destroying. For that practice, I would encourage you to give me those CDs. I make sure that they're wiped and then we dispose of them appropriately. So if you have any of those CDs or thumb drives lying around, feel free to bring those to me so that we can take care of them. This would also include documents that are saved locally onto our desktops. If we have a cloud-based system and so we don't need to have any information saved locally about patients onto our computers. So if you have any of that information, I strongly encourage you to delete it off of your computer, whether personal or a business-owned computer. So this would be like if you're transferring documents from UpDocs to your computer, saving it on your desktop, and then uploading it into eClinicalWorks. We need to make sure that those documents are deleted as soon as they're uploaded into eClinicalWorks. There's no reason to have patient information saved locally to your computer. It should all be uploaded securely into eClinicalWorks. Data security awareness. So there are physical safeguards to keep information private. When I was working on this presentation, what I kind of thought about is that the physical safeguards is like your common sense, being aware of your surroundings, is a way to keep this information safe. So that would include keep paper records locked in cabinets, store PHI out of sight from unauthorized individuals, provide physical access control to records, and secure physical devices when not in use. Technical safeguards are the securities that take place inside of your computer or inside our operating system that keep the information safe. Access controls allows only authorized persons to access PHI. This would include like our security settings in eClinicalWorks. For example, clinical staff only have access to information about clinical stuff, and our front office staff only has access to information about financials and insurance. There is not a lot of crossover between the access in those areas. There's no reason that a front office staff needs access to the progress notes, and there's really no reason for the back office staff to need information about what a patient owes or the invoicing. If that does come up, we can take manual steps to give you that information, but that would be on a case-by-case basis. Audit controls, the doctors and I have access in eClinicalWorks to run audits on employee activity in eClinicalWorks. We know who's opening charts and what sections of the charts you're trying to get into. This is just a safeguard to record and examine access and other activity and information systems so that we know that information is being accessed appropriately. Integrity controls confirms that ePHI has not been improperly altered or destroyed. So this comes up a lot as far as like lab results, and so we want to make sure that if a lab results actually happened, that it's not being deleted. We don't want progress notes of information that's true to be removed from the chart. Once it's in the chart, it needs to stay there. However, if something comes up that the wrong information was entered, that takes an administrator's access to be able to delete that information. And that's set up by design so that information is not being improperly destroyed. And then transmission security guards against unauthorized access to ePHI being transmitted over an electronic network. So this is network-wide security that protects about all the internet that comes in network-wide to our building. So what are some common security incidences? Leaving unattended PHI out in the open, theft or damage of equipment, unauthorized use of a system, so sharing passwords is not appropriate, violations of standards or policy, computer hacking attempts, malicious software, or security weakness. This pie chart shows that approximately 15% of these violations occurred due to hacking or IT incidents. While we do have some safeguards in place to prevent against this, a lot of that is out of our control. We use third parties that are in charge of our electronic systems, and if they have a breach, there's really nothing that we could have done to prevent that. However, that leaves 85% of violations that happen because of something that's preventable within our office. So I would encourage you to feel equipped that you are able to prevent these incidents from happening, and a lot of it does fall under things that are in your control. So I would just encourage you to take a look at these common incidences and know what pitfalls that you may fall into. Next section is about HIPAA breach and violations. So if a potential breach occurs, if something happens, what are you going to do? Notify the privacy officer immediately. So that would be either myself or Dr. Davis or Dr. Dennett. What you shouldn't do is try to determine by yourself whether or not it was a HIPAA violation. If anything is even a potential violation, we want to know about it so that we can take proper protocol to develop a risk assessment and see if it needs, we need to notify people outside of our clinic. There's a 4-part risk assessment that takes place using the following factors: the nature and extent of the protected health information involved, including the types of identifiers and the likeliness of re-identification, the unauthorized person who used the protected health information or to whom the disclosure was made, whether the protected health information was actually acquired or viewed, and the extent to which the risk to the protected health information has been mitigated. So there are different levels of potential breaches. Not all of them need reported, so that we have to determine via this risk analysis the next steps that are taken. The breach notification rule requires HIPAA covered entities and business associates to provide notification following a breach of unsecured protected health information. So if a breach does occur, we must contact the patient who is affected. We have to contact HHS, we have to contact the government, and we also, if there is a breach of over 500 patients, so a system-wide breach, we would also have to create a press release to contact the media. HIPAA violation tiers and fines. I'm not going to read through these tiers, but it's important to know that there are different tiers of fines, tiers of violations that would lead to a separate set of fines. To simplify it, you could think of the tier 1 as lack of knowledge, tier 2 as reasonable cause, tier 3 willful neglect, and tier 4 willful neglect not corrected within 30 days. It's important for you to know that there is an organizational responsibility from our business to follow HIPAA rules, but there's also an individual responsibility. So just because a HIPAA violation occurs doesn't mean that you're off the hook or that we're off the hook. We both will be responsible for these fines and the implications of the violation. Required notices to patients. So the Notice of Privacy Practices is available at the front desk. If you didn't know that that's available at the front desk, I would encourage you to take a look at where that's at and see what's in that Notice of Privacy Practices. Patients must sign acknowledgement of receipt to confirm they have been offered and received the Notice of Privacy Practices. If a patient does not sign the acknowledgement, the provider or the receptionist must document their efforts to obtain it and the reason why it was not obtained. So just because the patient doesn't fill out their paperwork for the year doesn't mean that they can't be seen in our practice, and it doesn't mean that we don't have to follow HIPAA and privacy practices. It just means that we will still follow the privacy practices, just the patient is not signing that they received or were given the opportunity to read that notice. Rights of access and inspection. Patients have the right to inspect and copy their PHI. There may be associated costs with this as far as printing the record or copying a CD of the disc, but they do have a right to examine that information. After a patient's visit, we automatically upload a visit summary and their lab results to the patient portal. But if they want a copy of their full progress note or any other results that are in the chart, we are required to provide that for them. Patients may request an amendment or a correction to the PHI. Providers must accommodate this request unless they did not create the information. So say it was from an outside consult and a patient is concerned that information is incorrect. Well, we didn't create that information in our office. We just have a copy of it. So they would have to go to the source of that information. The record is accurate according to the healthcare professional that wrote it. So if it becomes a he said, she said type situation and the provider maintains that what's in the record is correct, we would not have to amend it in that case. And also the PHI is not part of the medical record in the provider's practice. If we don't have a record, we can't amend that record. So why does this matter? Why are we making you sit through this presentation? Why do we have to follow HIPAA guidelines? Well, in the words of Debbie Dennett, it's the right thing to do. You know what's right and what's wrong. You know that it's the right thing to do, and therefore you should do it. But if that's not enough for you to follow, it's the law. And whether or not we like it, we are under the law, and this is a law set in place in 1996, and so we are required to follow it. Not only that, though, we must protect our professional reputation. We have a reputation within our community of Cali County. We have a reputation within other healthcare professionals in the state, in the country, and we should do everything we can to protect that reputation. I know that people think highly of our clinic, and I would like to keep it that way. And then furthermore, we can continue to build trust with our patients. We want patients to trust us and build that trust over time, and it's a great opportunity to show them that we keep their information private and we take their healthcare seriously, and we will do everything we can to provide excellent care for them and to respect their rights as a patient. So we're going to go into a knowledge check. These are just a couple cases that help you think of real life scenarios that could come up and see how we can deal with those. Knowledge check is just a nicer way to say quiz. And I'm not going to make you take a quiz, but I would appreciate if you walk through these scenarios with me. So Roxanne is checking in at the registration desk for her appointment, and there are several patients standing in line behind her within earshot. The receptionist asks Roxanne to verify her insurance information and change of address. Is this a HIPAA concern? So yes, it is a HIPAA concern. Staff are required to take reasonable steps to avoid incidental disclosures of PHI. Unfortunately, this does happen a lot in the front office. People stand too close to the front desk. They may even get right up there behind a patient. The receptionist should feel equipped that they can ask somebody to back up, stand a little bit further away, take a step back, take a seat, and then we will help them as soon as they're ready. People have big ears in the lobby, but we need to take reasonable steps to prevent people from hearing information that they are not, that they shouldn't be authorized to hear. Next, 2 employees are discussing a patient's treatment in a hallway when another patient walks by. Could this be a HIPAA violation? Yes, this is definitely a HIPAA violation. These employees should have had this discussion in a private area where they could not be heard by others. I would also encourage you to know that there should be no yelling of information from employees to other employees about a patient. So for example, like, did you get that PSA on Robert? That can be heard down the hallway. People now know that Robert is having his PSA checked. That is not appropriate to shout down the hallway. Another example would be like, do you have those immunizations ready for Olivia? Now everyone knows that Olivia is getting immunizations today. They saw Olivia in the lobby. They know Olivia's in room 2. All of these things, we have to be more careful about the information that we are saying loudly. If I can hear it in my office or if I'm walking down the hallway, we know that patients are hearing that too. And so I would encourage you to use inside low voices when talking to each other, not only out of respect for your fellow employees, but also just as a way to additionally keep that information private. Next, you're calling patients from a private location to remind them to schedule their AWV, or annual wellness visit. When you call Mrs. Green using her preferred telephone number, a man who identifies himself as Mr. Green answers the phone. What information can you provide to Mr. Green after you identify yourself? So you can say that you are calling to schedule an annual wellness visit appointment and Mrs. Green should call you back. You do not have to say any more than that. You don't have to go into a detailed list of her problems and things that we're going to address at the visit. You don't have to say less than that and just say, this is urgent, please have her call me back. You can just say, we needed an appointment and please have her call me back. Somebody in the live presentation brought up that we could check her HIPAA form and see if he's on that form. Absolutely. Definitely, if he's on the HIPAA form, you could give him as much information as he's asking. But in the case that you're going in blind and you can't get that form pulled up, you can just ask Mr. Green to have Mrs. Green call you back about the appointment. Next question is, your sister's friend just came to the office for a follow-up visit after being hospitalized for triple bypass surgery. Your sister asked you to let her know about her friend's prognosis. What should you do? Explain that it's a violation of privacy for you to provide this information or even seek it out. Especially if you weren't even involved with the care of the triple bypass surgery, there's no reason that you should know that data, and there's absolutely no reason that you should take that data from the clinic and go tell your sister since she's not involved in that patient's care. So be careful of the information that you receive at the office, and just know that there's no reason that it should leave the building. It should always just be used specifically for the care of that patient. Next question says, an elderly patient has come to the urgent care accompanied by her son. The son sits in the waiting room during the patient's exam, but the patient asks you to send the son to the exam room while you discuss the drugs that the patient needs to take. May you have this discussion in front of the son? Yes, absolutely, because the patient has invited her son to be present. The patient invited the son into the conversation. You absolutely can talk in front of the son. If there's somebody in the room during the exam, it's implied HIPAA consent that they can be a part of the visit. A patient has requested to restrict their health plan's access to their PHI. Can the patient's request be honored? In this case, yes, but only if the PHI pertains to items and services paid in full by the patient or their representative. So say a patient comes into the office and they broke their leg and they do not want their insurance company to know. That's fine. We can have them sign a form that says we're not going to submit this to insurance. The patient waives their rights to have insurance pay for it, but they'll have to pay up front for the services. They'll pay for the office visit and the x-ray and the casting, and none of that information will be submitted to insurance, but the patient is responsible for payment in full. And otherwise, if we are submitting claims to insurance, we have to also submit why we are sending those claims. And so there's no way to keep that information private while still submitting the claim to insurance. That is the end of the presentation. I really appreciate you following along with me and learning more about HIPAA and diving into this. We will have a presentation in the middle of the summer about fraud, waste, and abuse. So hang tight for that. There's more to come. We will hold it similarly where we have an in-person live presentation for whoever's available, and then we'll also have the recording of it that I'll do separately. As long as this worked well for you. If you have any feedback, feel free to share it with me. This is something that we haven't done before in the clinic, and so I'm happy to hear how you thought that it went. And furthermore, if you have any questions about HIPAA, whether it's about the presentation or specific scenarios, don't hesitate to ask. Let's work through it. Let's figure out the answer together, and we will find the information one way or the other. As always, I'm always available for questions about HIPAA as they come up. You know, there's so many different cases of ways that we need to follow HIPAA, and so there's no way to cover it all in one presentation. So we definitely can entertain questions at a later time. Thank you for watching and have a good rest of your day.